How to secure strong letter of recommendations from your US clinical rotations as a non-US IMG. Now, please note that there are multiple types of rotations in the US. There is electives, which is for medical students. There are observerships, there are externships, and the most hands-on of all would be sub-I or sub-internships, where you act like an intern. You'll be assigned some patients, and then you review the chart, present the case during rounds, and take care of the patients, putting in orders. So that would be the most hands-on of all. For this video purpose only, specifically, I'm going to address how to secure the letter from observership clinical rotations, because I would like to give you the most practical tips possible that you can even apply it. Let's say if your observership rotation is tomorrow, you can apply these techniques immediately. The issue is for sub-I or the one that more hands-on, it requires you more skills, more knowledge to actually perform really well. You need to understand the healthcare system. You need to understand about the EMR and how to review them. And it requires a little bit of time, skills, and practice to do that. And that is basically what I help people learn during my clinical rotation. That is my focus. I help them learn the US healthcare system, which a lot of misconception, people think that US healthcare system is about insurance and payer, etc. No, it has nothing to do with that. It has to do with resources and how to utilize those resources to help to take care of patients, because you are a clinician, you're not a case manager or social worker, you're not dealing with the payer. They are the one that deals with that. You deal with the patients. You take care of the patients. So that's one. Second thing I help students to learn is the EMR, because the EMR can be complicated for non-US IMG when they first enter the US system. So I'll help students to learn how to review the chart in the most accurate and efficient way. And the third thing is communication and interpersonal skills, because we as foreigners, we come from different language, different culture. So I'll teach cross-cultural communications as well during my rotations. Now, if you're interested doing clinical rotations and learn from me, there's a link down description below where you can click and then learn how to get the clinical rotations with me. Now, back to our original topic, I would like to give you very quick practical tips on how you can secure a strong letter of recommendations from your observership rotation. Now, we're going to talk about three big categories here. The first one is about professionalism. The second one is your dedications of self-learning and grow. And the third one is communication and interpersonal skills, of course. Okay, so let's get started. So the first category is professionalism. So what are the things that you can do to show that you're being professional? Well, the first one, obviously, is be punctual. So if they ask you to come at 7, I would like you to come at 6:50. So give like 10-15 minutes wiggle room. You want to come a little bit earlier than when they ask you. Okay. And then I want you to have 100% attendance, means you come every single day that they ask you to come. Doesn't matter if there is any winter storm, if there is any hurricane, if there's any blizzard or alien invasion, you want to come at 6:50 every Monday to Friday. I know I'm exaggerating here, but you get the idea. That is being professional. Now, the second thing that you can do to show professionalism is the dress, right? Make sure you know the dress code. Okay. If they say it's okay for you to wear a scrub, then you can wear a scrub. If you need to wear a tie, for example, then you wear a tie, whatever the dress code may be. And I want to make sure that is clean and neat. So that is being professionals. And you want to make sure also you smell nice. So I hope you don't smoke or drink, because if you smell cigarettes or you reek of alcohol, or even worse, maybe pot, I don't know, whatever that is, you want to make sure you smell nice. So wash up in the morning, don't use too strong a perfume. Basically, you just have to make sure that you come there as professional as possible with the right dress, neat, clean, and you smell nice. Okay, and be punctual, be on time every single day. That is being professionals. There are a couple other things that you can show that you're being professionals, which is be prepared. So depending on what kind of rotations you're going to go for, there are some equipments or tools that you need to bring, right? For example, if you do rotation with me, I actually expect you to have at least a stethoscope. If you're doing a neurology rotation somewhere, maybe at least you have a reflex hammer, for example, or maybe a tuning fork, things like that. You want to know what are the equipments or tools that will be helpful and commonly used for that rotations, and you want to have that and you want to bring it with you. Having all these tools ready show that you are well prepared, you want to be there, you want to come to learn. Now we move on to the second category, which is your dedication to self-learning and grow as a physician. What are the practical things that you can do to show this? Well, ask questions, right? It's as simple as that. You need to ask questions. So this one thing that my attending taught me during my residency. He said that there will always be a question in every patient encounter. It doesn't matter if you have seen a 100 AFib cases, every individual is unique, and there will always be a question pertain to that case. You just have to find it and then ask it. You see, now to make it simple and practical, these are the three different things that you can ask questions about: differential diagnosis, diagnostic workup, treatment. Simple as that, right? You can ask, is this differential diagnosis is possible? Should we order this test to rule out something or rule in something? Why we choose this treatment A over treatment B? These are the framework that you can use to try to ask good questions. The second thing that's kind of related of being professionals and be prepared, and at the same time showing your eagerness and your intellectual curiosity and your enthusiasm to learn, is to have a notebook. As simple as that. Bring a notebook, small notebook, with a pen or pencil, and then if you ask questions, you learn something new, or your attending just teach you something new that you feel that is important, you want to write it down. Just by doing that alone, it come across that you want to learn, so you write it down. It's just as simple as that. Have a notebook, write it down. The third thing is you want to apply it. So if you learn about something new during the rotations, after you ask questions or after your attending teaching you, you write it down and you want to apply it immediately if it's possible. I'm going to give you an example. So I have a student who rotates with me in my clinic, and we come across this patient. The patient said that he has chest pain, and then she would ask, for example, what makes the chest pain worse, or is there any shortness of breath, or if there's any fever, etc. And I taught her that one of the most important things to ask first would be time. When did it start? Because asking the time will create chronology, and if you ask chronology, it creates clarity and would be easier for you to write the notes later, or if you need to present the case. It will not provide clarity if there is no chronology in it. So time is very important. So I recommend her to actually start asking with time and onset. She wrote it down, and then in the next encounter, she was able to apply it immediately. Now that's impressive. So that means she's paying attention. That means she is learning. That's just one example, but there will be a lot of things. If there's anything new, the point is that you want to write it down and you want to apply it as soon as possible. Now, the next step is make sure that you have access to some resources. The big three resources that I usually use in my practice, it would be UpToDate, ChatGPT, and Open Evidence AI. So I use these three. If I would like to explanation about pathophysiology, etc., then I use the ChatGPT. I want to get the most up-to-date recommendations and in the fastest way possible, I'll use Open Evidence AI. Now, if I need some more of a well-structured explanation, then I would use UpToDate. So I use combination of these three. Now, if you have some access to it, usually if you do rotate in a hospital settings of some sort, they can give you access to UpToDate. So you want to make sure you have that access, because the thing is, there'll be time when the attending will ask you to look for something, and why don't you learn about this? You know, you can use UpToDate and the combination of these three to actually help you learn. And because of the advancement of AI, you learn it pretty fast. So I would highly encourage you to use the AI to learn medicine these days. The next thing that you want to do to show that you are enthusiastic learner is to ask for feedback. Yes, ask feedback in the middle of the rotation. So, for example, if your rotation is 2 weeks and you're going to be with that attending for the whole 2 weeks, you will want to ask for feedback in the first week and ask if there's anything you can improve. And then you can show the attending that you can change and improve on the next week. Because sometimes attending change every week. If you're only with the attending for that 1 week, then you're probably going to ask it in the third or the fourth day. So you have a chance to show that you have changed and improved on the following days. So make sure you ask for feedback. That will come across really good. So now we move on to the third category. Third category is communication and interpersonal skills. Now, this is probably the hardest one because it's a skill. And when it's a skill, it takes time for you to practice and train and learn. But for today's purposes only, I will try to give you some very quick practical tips. We're going to take a look at these three subcomponents, which is cross-cultural communications, verbal skills, non-verbal skills. So regarding cross-cultural communications, one thing that I want you to do is remember names. Yes, you're going to come across with a lot of people your colleagues, the staff, be nurses, maybe case manager, your attendings, different attendings. If they mention their name, I want you to make sure you remember their names. I want you to make sure that you know how to pronounce their names. And then typically, if it's a physician, they would want to be addressed using their last name, otherwise mentioned differently. So as I mentioned in the first part of the video, I offer clinical rotations with me. I did actually post in LinkedIn about how they can do a clinical rotation and learn from me, and there's a lot of people reaching me out, and there are people who call me hi Julius with first name. There are people who would address me, hi Dr. Julius, can I have the link for a webinar? And there are people who address me Dr. Haryadi. So just based on this alone, I can tell who are already culturally somewhat adapted to the US culture and some who probably never been in the US before because they don't know. But don't get me wrong, I don't really care, okay? I'm also a foreigner. I'm from Indonesia, and we use first name in Indonesia. It feels weird to use last name at first when it comes to US because nobody ever called me Dr. Haryadi. In Indonesia, they call me Dr. Julius. But in the US, they will use last name. The good thing is they are networking with me. They're reaching out to me. Now imagine if you are reaching out to US doctors who have fully adapted to the US culture, you're gonna come across as rude. So make sure that if it's doctors, typically will be last name. Some doctors prefer you use first name, and they will allow you to use first name, if they want you to. So again, remember names, remember how to pronounce it, and typically use last name. So that's the cross-cultural communication. Another tip for cross-cultural communications is doing a small comment and small talk. Americans love that. I love your shoes, I love your hat, I love your sweater, things like that. It's just very simple. They can come across to other people that you are a nice person. Now we move on to the second subcategory, which is the verbal. Verbal is quite difficult. I'm just going to give you super practical tips on how you can come across as really polite and respectful. And that is to use these words: would, could, should, wonder, mind, appreciate, please, thank you. For example, could you please blank, appreciate it, thank you. Would you mind if blank, please, thank you. I was wondering if you could, like, you see? So use the combination of those words and it will come across as being polite and respectful. As simple as that. That's just the tips for today. And the next one is non-verbal tips. You want to make sure you smile at appropriate times, right? When you meet new people, smile. And you have an open body language. Don't go a closed body language. Open body language. And lastly, lean your body toward the person you're talking to. For example, if you're in a clinic with me and sit with me, let's say you sit next to me and the one that's in camera right now is the patient and I'm talking to the patient. Now, if you're sitting next to me, but this is what you're doing, doesn't seem you're interested because your body language swaying away and your head are away from the patient or toward me who is sitting next to you. You want to have your body lean toward the person talking to you. And if I'm sitting on a computer, I'm answering some message and you, the camera is, let's say, the computer, and you sit next to me and the same thing, you're doing that, but you're not really paying attention to me and the message in the computer as I try to explain to you, then it will come across as you're disinterested. You're not enthusiastic. Doesn't seem like you want to be there. These are basic body language. Smile when you meet new people, open body language, and lean toward the person that you're talking to show that you're interested and paying attention. And that's it for today's video. If you enjoy it and you find it helpful, please click like and subscribe. And I will see you again in the next video real soon.